Good day, everyone, and welcome. I'm Jack Van Horn from the University of Virginia, and I am very proud to welcome you to this edition of our 2022-2023 Foundations of Biomedical Data Science Seminar Series. This lecture series is supported by UVA's Integrated Translational Health Institute of Virginia, the UVA Brain Institute, the College of Arts and Sciences, the School of Data Science, and through a grant from the National Institutes of General Medical Sciences. Since 2016, the Foundations of Biomedical Data Science Seminar Series has focused on the use of data science methodologies, artificial intelligence, deep learning, and statistical modeling as they pertain to differing themes in the biomedical and health sciences. This year's theme is data science and the public health consequences of the COVID-19 pandemic, where each Friday we enjoy presentations from leading thinkers about the issues, promise, opportunities, hurdles, and other things associated with understanding the secondary health effects of COVID-19. These include delayed health checkups, treatments, mental health, drug abuse, increased obesity, and the long lingering health effects associated with the SARS-CoV-19 virus. Participants selected for our Biomedical Data Science Innovation Lab program will leverage these presentations as vital material for our culminating in-person grant project development workshop to be held at the Lodge at St. Edwards Park in Seattle, Washington in June of 2023. Today, I am delighted to welcome our speaker, Dr. Folashade Agusto from the Department of Ecology and Evolutionary Biology at the University of Kansas. Dr. Agusto has trained as an applied mathematician who designs novel epidemic models to gain insights into the emergence and re-emergence of infectious diseases of public health importance and how to mitigate the risk that they pose to human health. She holds a PhD in mathematics from the University of Ilorin in Nigeria, as well as a master's degree in mathematics, also from the University of Ilorin in Nigeria. She has designed and analyzed novel models of diseases like Ebola, avian influenza, bovine tuberculosis, Jones disease, amongst others. Her current work is on modeling of tick-borne disease across the Great Plains and understanding the role of human behavior on the transmission of COVID-19. Her outreach programs involve capacity building and knowledge transfer across West Africa by organizing summer schools in mathematical epidemiology, ecology throughout the African continent. In continuing our 2022-2023 Biomedical Data Science Seminar Series theme, her lecture today is entitled Understanding the Impact of the COVID-19 Pandemic on Mental Health Using Network Analysis. Dr. Agusto will discuss the impact of COVID-19 policy actions on mental health in the country using mental health related indicators such as feeling anxious, feeling depressed, and worrying about finances using survey data that her group has analyzed from the Delphi Group at Carnegie Mellon University. As always, we are streaming this lecture live and for recording via YouTube. And if you are watching on YouTube, we thank you very much for joining us. Also, our specially selected 2022-2023 Biomedical Data Science Innovation Lab participants and alumni are encouraged to submit any questions they have via the chat feature in their Zoom sessions. I will synthesize these questions and ask them on your behalf during the last 10 minutes or so of the lecture. And with that, welcome, Folashade. We are very excited to hear your presentation.
Well, thank you. Thank you for the invite. I greatly appreciate it. So as we all know, COVID-19 is a respiratory disease caused by the novel coronavirus SARS-CoV-2. And since its discovery in Wuhan, China in 2019, COVID-19 has led to over 670 million cases globally and over 6.8 million deaths. And as you can see from this geographical map, this is indeed a pandemic because every cities in every towns in every countries have been impacted and is being impacted by this disease. Now, in a bid to control the disease, the spread of the virus initially, different mitigation efforts were put in place. So efforts such as social distancing, school and events closing, travel bans, infected individuals were quarantined and suspected cases were advised to self-isolate. And so some of these measures may have far-reaching impact on people's mental health and that of the general population. So our objective in this study are threefold. One, to understand the impacts of COVID-19 on people's mental health across the country, to identify the similarities between the states in terms of individuals' mental health, and to understand the impact of government and state-specific policies on people's mental health. So as overview to this presentation, I will start with a little bit of, I'll talk a little bit about the data and the government policy guidelines in place during the time frame of our study. And since we are using network analysis, I will talk a little bit about look at the relationship between mental health and government guidelines, and briefly go over the methods that we used, which is the clustering and the correlation method and the dynamic connectome. And lastly, I will conclude by presenting some results, and then I will close with a summary. So I'll start with the mental health and related data and policy guidelines. So the data we use are publicly available, and they are aggregated survey results data from Carnegie Mellon University Delphi Group. Now, this group distributed COVID-19 trends and impact survey in partnership with Facebook in the form of a daily voluntary survey that Facebook users could respond to. The survey questions ranged from those concerning physical health to economic impact of COVID-19 and to mental and behavioral prompts. So for this study, we selected 3 indicators of interest to represent the impact of COVID-19 on people's mental health. So these are the percentage of participants who experienced feelings of anxiety within the last 7 days, the percentage of participants who were depressed within the last 7 days, and the percentage of participants who were worried about their finance for the following month. So in addition to looking at the individual states, we grouped the data in 2 different ways: geographically and politically. So this is the geographical map of the country, divided into 4 regions, namely the Midwest, the Northeast, the South, and the West. And there are different ways in which the country can be split geographically. So in many cases, it may be based on historical relationship within certain regions. This relationship can stem from similar religious community, cultural similarities, shared historical significance, or similar climates in the region. So in this study, we used a geographical grouping from the United States Census Bureau. Now, this is the map of the country along political party preference, and we focused on the 2 major political parties, the Democrats and the Republicans. And the political party preference was determined from the results of the 2020 presidential election. So these are the data along regional lines for the percentage of individuals feeling anxious, feeling depressed, and worried about finance. And these are the same data that we have grouped along political party preferences. So in order to see if there's any relationship between the trends in mental health indicators and the trends in the COVID-19 cases, hospitalization and deaths, we also grouped the COVID-related data along regional lines and political lines. So these are showing the regional lines grouping, and these are the ones for the political lines grouping. And we see from this plot 3 distinguishable waves. So the first wave was from March 2nd to July 1st, 2021, and the second wave was from July 2nd to November 11th, 2021, and the third wave was from November 12th, 2021 to January 10th, 2022, which was the end of a study period. So several mandates were enacted to alleviate the public's burden of the pandemic. So some policies was about nationwide vaccine rollouts for all adults, unemployment benefits, and eviction moratorium. And we postulate that some of these policies could impact individuals' mental health. So here are the list of the mental health policies and mandates. Now, these sets of policy guidelines might affect feeling anxious and depressed because it involves controlling the disease. Now, these sets of guidelines might affect finances because it involves unemployment benefits, stimulus check, and eviction moratorium. So that's that with the policy guidelines. So now I will talk a little bit about the methods we use, starting with the correlation and clustering. So to create the network across the states, we started by obtaining a correlation coefficient matrix for each pair of the states using the time series data for each of the mental health related data. And we use the Pearson correlation formula to determine the correlation between states X and Y. Now, if the correlation coefficient is not equal to 0, that indicates that states X and Y are connected, otherwise they're not connected. If the coefficient is bigger than 0, it indicates that the two states X and Y have positive correlation between them. And if the correlation coefficient is smaller than 0, it indicates a negative correlation between the two states. Before I move on, and we use this correlation coefficient matrix to form the adjacency matrix, which defines the connectivity of states on a network with respect to a particular indicator. And we use all the correlation coefficients, unlike what is normally done, where a cutoff is set and only the strong association are considered. So we wanted to incorporate all the broad ranges of the states, similarities, and not just the positive ones. So once we've obtained our connectivity matrix network, next we cluster the states according to how similar they are using the Layton algorithm. We first split the network into positive and negative subnetwork based on the sign on the correlation matrix. The positive subnetwork contain only the positive connections from the original matrix, and the negative subnetwork contain only the negative connections from the original network. We then apply the find partition function to both subnetworks to obtain the cluster for each of the subnetworks. And then we apply the optimize partition multiplex function to both sets of cluster to obtain a single set of cluster for the original network. Now, since the clusters returned by Layton algorithm are not unique, we run the Layton algorithm multiple times in order to create a consensus cluster. And then lastly, we construct an allegiance matrix with all the mental health indicators. In this case, we only have 3. So we use all 3 to create the allegiance matrix. Now, the allegiance matrix gives us the probability of 2 regions being in the same community across all the mental health indicators. So next, I will display the results of the consensus and allegiance clustering, which we use to group similar states together. So here are the clustering of the indicators for feeling anxious and worried about finance. The colors indicate the clustering of the states. Now, with these 2 indicators, we see 2 clusters, and you can see that the southern states are mostly in 1 cluster. For feeling depressed indicator, we see 3 clusters with no distinctive pattern, unlike what we have for feeling anxious and worried about finance, where the southern states are mostly clustered together. Now, using all the 3 mental health indicators, we create an allegiance clustering of the states. This indicates which states are mostly likely to be grouped together or exhibit similar trends across all 3 mental health indicators. And here we see three main clusters based on the colors. The southern states are mostly grouped together, except for Arkansas, Virginia, and West Virginia, which are not as frequently grouped together with the rest of the southern states. Now, this color in light blue include California, Illinois, Nevada, and North Dakota, which are non-southern states. And we should note that the southern states are also Republican states, except for Georgia and Virginia, going by the 2020 presidential election. So now I'll move on to the dynamic connectome and how we created the associated time series. So we used the sliding window to create the dynamic connectome of each indicator time series. Now, this technique is commonly used in the field of neuroscience to examine brain network dynamics. So in our sliding window analysis, we took a fixed window of 30 days and we slide by one day. And we then computed the average correlation values for our mental health indicators across the mental health, across the network within the particular window that we're sliding through. Now, the slides or snapshot leads to a time series, which we plot to display the dynamic fluctuation in the indicator of interest across the time frame that we used. So we did this for the three mental health indicators that we were considering. So now I will show you the results of the dynamic connectome constructed using the sliding window analysis. So here are the plots of the dynamic connectome along geographical regions and political party preference for each of the mental health indicators. And as mentioned earlier on, we observed 3 waves in the time frame that we used. So that splits the dynamic connectome for each of the indicator into 3. And we indicate each wave with a vertical dash line with this blue vertical dash lines. And the horizontal dash line is just to show the width of the wave. So if we look at all the plots together, this is what we have. So when I say all the plots together, I mean all the plots together for the regional connectome as well as the political connectome. So this is what we have. And we see for the first wave, the Midwest, the Northeast, and the Democrats or the Democratic states have the highest average correlation for feeling anxious and feeling depressed. So we're looking at this first part of, for this particular indicator and this indicator. So the Midwest, Northeast, and the Democratic states have the highest average correlation value during that time frame. However, for worried about finance, there's a weak correlation between each region or political party states, except during the initial parts of the first wave. So I'm looking at this here, where the Southern and the Republican states have the highest average correlation. For the second wave, we see the Southern states, so that's this middle part here for the 3 indicator, whether you're looking at it geographically or politically. So the Southern states and the Republican states consistently have the highest average correlation value for feeling anxious and feeling depressed, as well as worried about finance. For the third wave, we didn't see any distinctive pattern for all the indicators, and the overall correlation value is weak and negative in some instances, which just simply show that during this period in the pandemic, there's no strong similarities between the states. Since we're dealing with network, Here are the dynamic connectome for the eigenvector centrality across regional and political party preferences. The eigenvector centrality measures the transitive influence of each state. So it tells us how important the connection of each state are. So as we saw earlier on, we also have all of them put together, the eigenvector centrality, the time series of the eigenvector centrality along regional lines and political lines. So we also see similar trends with the Midwest, Northeast, and the democratic states having the largest eigenvector centrality during the first wave, while the Southern and the Republican states have the largest eigenvector centrality during the second wave. There are no distinctive pattern in during the third wave, but the values are much larger than the average correlation values that we observed with the correlation connectome that I showed earlier on. So I've shown you all this analysis that we've done and results that we've obtained. So the question you'll be asking is, so how do we bring all this together? How do we assess the impact of these policies and mandates on people's mental health? So to assess the impact of this policy on people's mental health, we superimpose the correlation outcomes onto the COVID-19 related data and identify the policy implemented during this times. So this allows us to see if a correlation value was indicative of the COVID-19 cases, hospitalization, deaths, and the implemented policy. So I will discuss the results using the political party dynamic connectome, since I have fewer curves on that plot, unlike the regional ones. The conclusion of the results of the geographical regions are the same, and I'll show this later on. So I will start with feeling anxious and feeling depressed. So for either of this mental health indicator, we see that the democratic states have the highest correlation value during the first wave. Now, during this particular period, there were two policies implemented. So the first policy was on April 19th, which guarantees that all American adults are eligible for COVID-19 vaccine. And we reasonably assume that this led to a decrease in reported percentage of anxiety and depression. The second policy was a CDC guideline update on masking, which was made on May 13th. In their guidelines, CDC retracted their recommendation for fully vaccinated individuals to wear masks indoors or outdoors. Now, this policy, however, is kind of ambiguous in the way individuals will interpret this, because some individuals can consider this guideline to indicate a decrease in severity and danger of COVID-19 pandemic, while others may see these as a premature decision and worry about the potential outcome of making these announcements. So notice that during this period, the democratic states experienced the most COVID-19 cases, hospitalization, and deaths. So I'm talking about this time frame in the pandemic, during the pandemic. And so overall, it makes sense that the democratic states have the highest correlation values as regarding to feeling anxious and depressed, even though feeling depressed and feeling anxious were on the decline during this period. So right now I'm showing you the plot for feeling depressed. And so you can see during this first wave that individuals, the percentage of individuals feeling depressed was on the decline. And if I move the slide backward by just a slide, you can also see that for feeling anxious, that is also the case. So during the second wave, we see an increase in the correlation values within the Republican states. Now, during this time, CDC announced on July 3rd that COVID-19 Delta variant was responsible for over 50% of all COVID-19 cases. And we noticed that there's this large increase in COVID cases, hospitalization, and deaths among Republican states. And it makes sense to see that the percentage of those feeling anxious and depressed was high in the Republican states during the second time frame. And during the third wave, the correlation between the states were weak. And during this period, FDA extends the Pfizer eligibility to 16 and 17-year-olds, and CDC shortened the isolation and quarantine period. So during this third wave, the COVID-19 cases, hospitalization was on the rise, mostly in the Democratic states, while the deaths were higher in the Republican states, which explains the high anxiety and depression in the Republican states. So for worried about finance indicator, we see this high initial correlation value among both political party states during the first wave. So that's this initial part here, and which aligns with the percentage of people worried about finance in the first few days of this time frame. However, we start to see this decrease in the number of individuals worried about finance. And during this period in time, on March 11th, President Biden signed a coronavirus relief package, which extended unemployment compensation and included a third wave stimulus check. Now, during the second wave, we see an increase in the percentage. So we start to see this increase in the percentage of individuals worried about their finances within both states, but mostly among the Republican states. So, however, during this time, we see a large increase in COVID cases, COVID-19 cases, hospitalization, and deaths in the Republican parties. This, of course, was when CDC announced the presence of the Delta variant. Now, during the third wave, there was no clear correlation between the political states, but overall, individuals in the Republican states worried more about their finances than individuals in the Democratic states. So here are the regional connectome for feeling anxious and feeling depressed and worried about finance, and the same factors influencing the dynamic connectome for political parties also affects the regional connectome. So this is feeling anxious, feeling depressed, and worried about finance. So this is a short talk. And so to conclude, in this work, we use clustering in network analysis to study the similarities between states and how COVID-19 impacts the mental health across the country. Using mental health indicators such as worried about finance, feeling anxious, and feeling depressed. We superimpose our correlation outcomes onto COVID-19 related data, so mainly the COVID cases, hospitalization, and deaths, as well as onto the implemented policies and mandates that were enacted to alleviate the pressure of COVID-19 on individuals in the community. And our results with numerous studies, our results agrees with numerous studies that observed an increase in negative mental health conditions across across the country in parallel with the emergence of COVID-19. And we saw that the southern states clustered together in the same group for feeling anxious and worried about finance indicators. We didn't see any identifiable communities clustering for feeling depressed. Using connectome results, our connectome results, we saw an increase in feeling anxious and feeling depressed in the southern states, which overlapped with increase in COVID-19 related cases, deaths, hospitalization when the Delta variant was spreading rapidly. We saw an increase in worries about finance, which can be explained by the emergence of the Delta variants. And we also saw that the government economic relief package only impacted this mental health indicator during the first wave of our timeframe, of our study timeframe. So before I conclude, this work was led by Hiroko Kobayashi, who was then an undergrad student and currently interviewing for grad school in cell biology, neuroscience, and physiology. So she was supported by Raoul Sanz, who was also another former undergrad in my lab, and Alexander Falk, who is my current grad student. So this work was supported by grants from NSF. So thank you. I will take your questions.
Wonderful. Thank you so much. Folashade, it looks as if that period of around October of 2021 looked like a particularly salient period from some of the graphs that you showed. And in particular, there seemed to be more deaths amongst those who identify as Republican. And I'm curious if you had any evidence to indicate that some of that might have been due to resistance to vaccinations or to social distancing policies or other things that might have been fueled by the media during that time. And I don't know if you have data to support that or if you have any suspicions about that, but maybe you could comment.
Well, that's a real great comment. We did not think about that when we were looking at this results. That would be something for us to investigate a little bit more, but we didn't consider that when we were looking at this.
Yeah, it just looks like that period of time, all of a sudden, the graphs sort of diverge. And even if there are periods where, earlier in an earlier wave, the blue line was higher, it was like a delay of the inevitable in some instances where there might have been some resistance to it, but eventually there was no hiding from it. And I'm just kind of wondering if that was evident from any media. I'm not sure what data exists there, but if that might be helpful to try to explore.
Yeah, we will definitely look at this because right now this work is under review. So we've just gotten the first review comments back, and with this comments, we would certainly look at that to see if that is having any influence on what we're seeing with the deaths among the Republican states, and I'm also sure among the southern states as well.
Because it is kind of interesting to see some of those differences in the curves in terms of, here, the one you're showing on the screen now. So in terms of, feeling anxious, right around that time, seeing a change in the number of cases and hospitalizations and deaths, during that particular window of the fall of 2021. It wasn't good if you were of one particular political party than the other. It would just be interesting to see if that correlated with any of the news media at that time.
Right. So we were doing a lot of back and forth and trying to superimpose things, but we did not, for some reason, we didn't think about that because in other work that we've done, we've looked at public sentiment, not in this work. So we've looked at public sentiment, actually using Twitter data to look at that. And so
that's what I was going to suggest or ask about, is that if
Yeah.
you didn't have an opportunity to look at some kind of archival Twitter related activities around those times and see if that didn't maybe anticipate like the number of cases and hospitalizations and deaths that occurred. If Twitter was particularly active,
Right.
in the weeks prior, it's kind of anticipated it. But anyway, I'll leave it to you to go look
Right.
that up. My
Right.
another question I have is, are you looking to extend these analyses and carry the timelines forward as we're kind of, entering or, in the midst of, I guess, this post-COVID era, to see how any of these sentiments have changed, even though cases, hospitalizations, and deaths have kind of mitigated?
Well, that's a great suggestion, which it will be an interesting thing to look at. But my concern is the data that we would use to be able to do that. Because I'm not sure whether the Delphi Group continues to track this sort of data, because since we use their data to do that, and we would have to look at if we need to use Twitter data to be able to see what people's sentiments are. We see if we can be able to track that data.
So with the Delphi people, have they, I'm not familiar with them, but that doesn't mean anything, but I'm curious, did they, have they stopped collecting any further data as of January of 2022, or?
I don't want to be definitively and say no,
Okay.
or yes, I'm not sure. But I think that they have, but I'm not sure.
And what role do you think that data scientists and people with quantitative backgrounds, mathematicians, and other folks who are interested in the modeling of these things, what further do they have to add to help guide future mental health related research and policies?
That's a deep one. Well, I believe that the role would just be for us to continue to shine light on what we're currently doing and showing the necessity for this collaborative work that this is bringing together. Bringing people with different and diverse background together. Because on our own as mathematicians, we would need biologists. Even though I'm a mathematician housed in the biology department, we would still need people with people in social sciences to help with the interpretation of the results that we've gotten. Like you can clearly see from even the questions that you're asking me about considering the resistance that people had, which we didn't think about. I did this work with my undergrad, so we didn't think about that. So, but if we've done this work with, more individuals with social scientists, as we have with our ongoing project, looking at incorporating human behavior, we would be able to have better interpretation and explore better avenue and questions concerning this, concerning the problem that we're currently faced. And so I think that having collaboration with individuals from different fields would help shine light into mental health situations that were faced, particularly with the outcome of with this pandemic, what we're currently faced with this pandemic.
So I'm sensing that you have an appreciation for a team science kind of an approach. And I'm curious if, you were able to leverage people from other disciplines in the analyses of these data and get their assistance in their interpretation, or whether you have done so in other projects that you've undertaken.
I have done so in other projects that I have undertaken, but not with this particular project. So with this particular project, it was done with my undergrad students. But with other projects like the public sentiment one, so we had an economist in the group who's an expert in working with Twitter data and other kinds of data of that nature. So he did the sentiment analysis that we used. And we also, on a different project, we had a game theorist in the group who helped with formulating some of the model aspect of what I wanted. So I'm like, this is what I want. And then he helped to craft the model the way that I wanted it. So I have done some collaborative work with others, not on this particular project, and I continue to do that even with other things that I'm working on, like the tick projects that you mentioned earlier on across the Great Plains. So we have a team of biologists and people who would do experiment testings, and I would just come in with my modeling background, my math modeling background, to model things, and then we'll bounce ideas off each other.
Tell us a little bit more about your tick-borne illnesses that you're doing throughout the Great Plains. I'm sure that there's a major data science element to that, the modeling aspect, but also the team science kind of approach that you're drawing from. Can you tell us a little bit more about that project?
Certainly. So this is an EPSCoR project that involves, I think, 6 universities across Kansas and Oklahoma. And so our team has been collecting tick data at different sites since, I think, just before the COVID, I think. And so they've been collecting this data. And right now we have, so the goal is to be able to look at the phenology. Well, that's not just the goal. So based on the data we've collected, we've seen some interesting results based on the phenology of the ticks that were collected across the 2 states. And we have a team of scientists who will be testing those ticks for pathogens. And one of the interesting things that we've seen is that I think it's the exotic species of ticks. Some of them are winter ticks, in which is something that we didn't see or others haven't seen before. So these ticks come out in the winter, as against what we expect, which, they expect them to come out in the spring, I think, but then instead they come out in the winter. So our team have been collecting this data, and right now I'm doing some modeling work where we are also, because I'm interested in looking at mitigation efforts when it comes to different diseases. So we have a couple of papers where prescribed fires and mitigation efforts used in controlling the ticks. So we've seen from the study, from the modeling effort, that prescribed fire has some impact in reducing ticks, but which of course does not totally eliminate the ticks. And so this summer I will be leading a research group in the African in Diaspora research group in Berkeley, MSRI Berkeley research group, looking at ticks and ticks control and fire. where the goal is to, well, the question I'm interested in addressing is, given the fact that prescribed fire cannot completely eliminate ticks, what other mitigation efforts will be necessary to be able to control the ticks?
That sounds like a fascinating project with many dimensions and a lot of painstaking work. So we wish you all the good luck in as you undertake that project. It sounds fascinating. I know one other thing that you do, which I'm curious to hear about, is some of the work that you're doing with the summer school that you run in Ghana. And I know that you're probably also connected to folks in Nigeria as well. Tell us a little bit more about some of your activities in Africa.
So I am running a mobile clinic-like thing. So I call it mobile clinic because we're going from one country to another in West Africa, specifically in West Africa for this particular summer school. So we started in Benin, and then we went to Senegal and then Nigeria. And this summer we're going to Ghana. And so we've gotten some seed money from SIMPA, so that's Center for Pure and Applied Math, I think. So they've given us some seed money, which we're still looking for more money. So if you know how I can get more money, I would really appreciate it, because it supports master's students to come to this workshop where we have some 2 weeks training. We give them some classes and then some projects to work on during the 2 weeks. And so we've gone to those countries, and my hope is that once we leave Ghana, we can go to another West African country. I am particular about West African country because there is a big group in Southern Africa. I'm also part of that group. Well, it's an offshoot of, well, I'm not sure whether it's an offshoot, but they're together. You have SAMSA, and then you have Masamu. Masamu is mathematics in Swahili, I think. So I'm part of the Masamu group, where we are collaborating with African scientists to do different projects. And so the goal is to also do this capacity building and technology transfer. I am a product of such collaborative efforts. And so this is with DIMAX way back when I was a grad student. So DIMAX and some folks who did this training workshop where I met my postdoc mentor, Susan Reinhardt, and I was able to come to the States and work with her, and I'm here now. So I see this as an opportunity to give back to my community and help with the knowledge gap that I know that we're experiencing as well.
I think that's really great. And I completely agree that having that opportunity to give back to the community is super, super important. And I'm curious if you are familiar with the H3 Africa people that I believe are in Cape Town. Are you familiar with that effort?
Maybe if I know the full meaning of H3.
The H is human heredity in health of health in Africa. So that's what the H's stand for. But it's based at the in Cape Town, and they are actually NIH funded, which is kind of interesting. And they are really trying to integrate global health, data science. There's a huge data science component to it, public health, looking at heritable diseases, but I think they also are looking at things like, various viruses and communicable disorders and whatnot, who may be more susceptible. But I would encourage you, if you're looking for connections who may be able to help you identify means of further support, connect with the H3 Africa folks. It's h3africa.org. And they are, I know you're focused in West Africa, but I think they're really looking across those countries from across the African continent who are, for political reasons, able to come together. There are some countries in Africa where that's not possible, but in those that are, they are just having they just had the 20th H3 Africa Consortium meeting in Cape Town, where they had quite a big conference of folks from around Africa. A couple of years ago, I had an opportunity to go to Cape Town and participate in one of their H3 Africa activities concerning bioinformatics, and it was a fantastic time, and I thoroughly enjoyed my visit. And they are very interested in identifying collaborators, and so that may be a good option for you. And they may also have access to some data types that perhaps may be very interesting for you to consider modeling.
Right. I would reach out to them. I'll look at the website and reach out to them.
Definitely do that. And I'm curious, how long have you been at the University of Kansas?
So I've been at the University of Kansas since 2016. After my postdoc at the National Institute for Mathematical and Biological Synthesis, NIMBIOS, I got a job at Austin Peay State University in Tennessee. I was there from 2011 to 2015. Before and then I first came to the University of Kansas as a Langston Hughes Fellow, as their first STEM fellow. So they have this program where they bring minority scholar to the university, up and coming minority scholar to the university. But so I happened to be their first STEM fellow. The program had been on since the 70s, I think, the late 70s. But for I don't know, for whatever reason, they never had any STEM person until me.
Well, you did them a favor, it sounds like. Good for you.
Yeah. So, and then I spent a semester where I worked on a malaria model, multi-scale malaria model. So I created the first multi-scale malaria model using the life stages of the parasite in humans and in mosquito with my colleague, Maria Rive and Maria Light from University of Florida at St. Petersburg. So after that, they offered me the job, and I started in 2016, and I got tenured just this last year. So, which is very exciting.
Congratulations.
Thank you.
So what do you, as we kind of look to wrapping up here, what do you see happening with this type of modeling over the, say, next 5 to 10 years?
So what I see happening has already started happening in the sense that we will see more realistic models coming up, and NSF is in the forefront of that, pushing that with the call that they had where, well, the call is ongoing, and they had a call last year on how to create models incorporating human behavior, because with most of the COVID models that people focused on last year, the human components wasn't included. And so NSF put a call out for people to submit proposal to create models incorporating human behavior. And our team just happened to be one of those first 8 teams supported by NSF to incorporate human behavior. And our team will be looking at the consequences of isolation and incorporating human behavior into those model consequences of isolation on domestic violence, opioid misuse. So that is what I see happening in the next 10 years. There'll be more realistic models where we will be accounting for this human behavior and consequences of outbreaks such as COVID-19, public sentiments and people sentiments, and all this sort of human behavior will be incorporated into the models, and not just the traditional compartmental model that we've been doing in the past.
Well, Folashade Agusto from the Department of Ecology and Evolutionary Biology at the University of Kansas, thank you so much for sharing this work with us, giving us a lot of food for thought. I encourage you to reach out to the H3 Africa people. I think you may find some interesting comrades there, and do keep going with this really impressive work. And we look forward to kind of watching further progress here over the next decade or so. Thank you again.
Thank you. I appreciate the invite.
Thank you, everyone, for joining us today. Next week, we're taking a little spring break, so we will not be having a seminar series lecture next week, but we'll see you the following week as we continue our lecture series into the spring. So have a wonderful weekend, everybody. Have a good spring break, and we'll see you again real soon. Thank you.